Falls are the leading cause of injury-related hospitalizations among Canadian seniors. Specifically, 20 to 30% of seniors fall each year. The best identified approach is to take multiple approaches and heavily assess each resident in order to create an individualized form of care and in order to properly manage and prevent falls. Working collaboratively as a team is also an important factor in managing and preventing falls here at Yihong. Yihong Falls policy is very comprehensive and covers a lot of different topics. In this video, I'm going to be covering a few specific key points in order to create a baseline so that we all have a general understanding of what the falls policy talks about. Firstly, to assess each resident's risk for falls, the Morse Falls scale is used upon admission, readmission, and when there's any significant change in health. Secondly, after a fall has occurred, a post-fall huddle takes place where all the members of the interdisciplinary team get together in order to discuss what the next step should be in order to figure out how the resident fell. Thirdly, a routine head assessment takes place if there's any suspected head injury. And fourthly, collaboration with the pharmacist also occurred in order to review the medications and to ensure that there aren't any medications that may be increasing the risk of falls for that resident. Some of the interventions highlighted in the Yihong Falls policy are as follows. Offering the resident fluids every 2 hours, ensuring the resident is in a comfortable position and that they are warm and dry, performing a safety check every 1 to 2 hours, ensuring they have proper footwear, ensuring the bed is in its lowest position, implementing a toileting program, using hip protectors when necessary, and making sure the call bell is within reach. Now that we've discussed a little bit about the Yihong Falls policy, we'll be moving on and talking about the RNAO best practice guidelines and what the RNAO recommends in order to prevent and manage falls. Firstly, the RNAO heavily emphasizes the importance of assessment, specifically upon readmission, admission, and when there's any significant health changes. Furthermore, they also emphasize the importance of reassessment and making sure that the implementations of interventions previously made are being followed up and being properly implemented for that resident. For example, if a toileting program has been implemented, other nurses should make sure that this program is being followed properly, and that if there are any adjustments that need to be made in order to make the care plan more effective for this resident, then those changes should be discussed within the interdisciplinary team in order for it to be implemented into the care plan. Furthermore, when you are assessing a resident, you should also include if the resident has had a history of falls and gait, balance, or mobility issues as well, as these are all important factors in managing and preventing falls. The RNAO also places a heavy emphasis on the importance of ensuring that each resident has an individualized and tailored care plan in order to manage and prevent falls. The RNAO best practice guidelines for managing falls and preventing injury-related falls recommends individualized exercises such as heel-to-toe marching, marching in place, and shoulder rolls that improved physical strength and balance. Furthermore, vitamin D supplements have been shown to improve muscle function and strength, which can all contribute to preventing falls from occurring. Additionally, the issue of polypharmacy has been identified as a very big factor in contributing to the high incidence of falls within the elderly population. This topic of polypharmacy has been covered in another video I have done with a colleague of mine, and you can find this link to this video down below. In conclusion, through proper assessment, effective intervention implementation, and interprofessional collaboration, falls can be effectively managed and prevented here at Yihong.